Greetings from Manipal Hospital, Baner, Pune. I am Dr. Karan Chanchalani. I am a clinical and radiation oncologist. With us today is Dr. Lakhan Kashyap. He is our medical oncologist, and together we are part of the onco team at this hospital. We'll be talking about various myths around the treatment of cancer, around its diagnosis, and what are the correct facts, because it is very important to understand our enemy before we can actually treat it. So if we understand the knowledge behind it, as well as what is working, what is not, and a scientific evidence-based approach will be the one which will deliver the best of the results. So coming to next, so like this was a very common that I get to hear from my OPD. So biopsy will spread the cancer.
So I think there is an unfounded kind of a fear that biopsy can spread a cancer. If you see first you have to understand what is the biopsy.
Yeah.
So biopsy is a procedure in which we obtain a very small amount of tissue that can be obtained directly through a needle when the tumor is palpable, or it could be obtained through some guided measures such as CT or USG guidance when the tumor is inside our body. So a very small part of the tumor is taken. So when that tumor is taken, it is put under the microscope to find out what is the kind of cancer, so that the treatment can be appropriately planned. This doesn't increases the risk of spread. It just takes a small tissue, and if sometimes what happens after the biopsy, the tumor starts growing. It is a natural biology or the natural process by which the tumor increases in the size. The biopsy doesn't alter its growth rate. It just helps us in diagnosing so that proper and early treatment can be planned.
Yeah. So it's very important to understand. Sometimes what happens at the site of biopsy, some redness can appear also. So people frequently mistake that as increase of the symptoms or increase of the size. Biopsy has till date, there has been no scientific evidence or no scientific studies which have shown that it either disseminates the tumor or it actually helps in promoting its growth or something. So rather a biopsy is required in almost every case to ascertain the type of tumor before we start treating it. We need to know our enemy, like I said, before we treat it. So there are other myths around the treatment. So like there is a very increased the fad these days of trying herbal medicines like turmeric or garlic or even certain rare type of green teas that can cause that can cure cancer. So how much of it is correct?
So if we see these kind of herbal remedies, this alternative treatment or the supplements, they may be helpful in promoting a good health. But as with everything, if we see, everything should be taken in moderation. If they take excess of anything, that could interfere with the metabolism of our body. It can interact with the drugs or the medicines which are being used for the treatment of cancer, and it could sometimes produce some undesirable side effect. For example, if you take the example of the garlic, it has a natural anticoagulant. So if someone takes it in a large quantities, there could be a risk of bleeding. If these patients can undergo surgery and if they do not reveal this kind of information to the surgeon, and when they operate, there will be higher risk of bleeding. So these things, definitely in moderation, it is fine. It should be part of your healthy diet. It can be taken, but always discuss with your treating oncologist or treating doctor whether you can take this medicine, these foods, these supplements along with your ongoing medications. That should be the answer. That should be the proper thing to do.
Yeah. So there is one more angle to it. Can yoga be used to cure cancer, and especially without side effects? I'm putting it under the inverted commas, so without side effects. I mean, it is always a desire to have a treatment without any significant side effects. But yeah, speaking about yoga, can that be used?
Yoga, as a practice, it is a very good practice. It helps in promoting a good health. But as of now, there has been no evidence that yoga in itself can cure any kind of cancer. Definitely, with the cancer treatment, even if it is a surgery, radiation or chemotherapy, there are certain side effects. So yoga can definitely help in coping up with those side effects. It can help our patients to come to bring the normalcy in their life, so that they can function as a normal individual after this kind of a treatment, which takes a lot of toll in their body. So definitely yoga is helpful, but not in alone is able to cure the cancer.
Yeah. So I'll just add one more thing to it. So all these alternate medicines, especially yoga, sometimes are promoted like to reduce those side effects or help in coping the things. So especially yoga, there is now scientific evidence that has started coming in that it can actually improve the mobility of the system, maybe convert your metabolism to a more favorable state wherein you are actually not losing too much of a weight during treatment, and all those side effects can be better. So in our department also we are now trying to have a prospective randomized study wherein we'll be studying the effects of yoga during radiation therapy and how it is improving so it is mainly designed for breast cancer patients. So regarding the shoulder movements and also these things can be planned, and a evidence-based treatment can actually help in improving these things. But short of any evidence, blindly trying any herbal medicine or any other thing with a good hope that it will cure cancer can actually be countered, because when the tumor progresses, sometimes the ones which were previously better treatable or better curable and actually sometimes become palliative cases. So we have seen that frequently in our clinics.